Good morning, and thanks for watching another in our series of video learning modules associated with the Mother's Mental Health Toolkit project. I'm Dr. Joanne McDonald. I'm a psychiatrist who works with the Reproductive Mental Health Service and Dalhousie University. We're going to talk a little bit this morning about mothers experiencing adjustment disorders. First of all, what are adjustment disorders generally? Well, adjustment disorders are a mental and emotional disturbance that can occur for any person, really, at any time of life. It's not exclusive to mothers. And it's a time-limited change in emotion, thinking, and function related to one or more specific identifiable triggers. So it doesn't come out of the blue. Even at least after the fact, you can figure out that there were probably some things that set off this particular mental health problem. But what about how do adjustment disorders present particularly in mothers, and what would make them vulnerable to this particular problem? Well, adjustment generally follows change. And adjustment disorders or responses need to be the greatest when the changes involve more stress or demand, there's increased conflict, new roles or loss of supports, both a person's own resources internally, but also their practical support of other people. So mothering challenges, as you can imagine, involve all these aspects of adjustment as a normal course of life. So the risk for an adjustment disorder with mothers becomes higher, both in pregnancy, in the early months after a child is born, and even into those first busy years with children under the age of 5 or 6. How do adjustment disorders present? What are some of their features? Well, the stressors and changes are ones that you can see and understand. So they don't tend to be internal, unknown, or mysterious changes that come from the person's past life. They tend to come from triggers or stressors that are in their sort of recent or immediate life. Now, they may be associated as a kind of an echo of a previous problem or a previous trauma, and that might heighten the risk of an adjustment disorder with the new stressor. The person has difficulty using their coping strategy, their usual coping strategies. Either it doesn't fit the new situation, or they just can't seem to sort of muster it and do it in the same way. The emotions that women can experience with an adjustment disorder really can be very broad. They can appear to be depressed, they can be irritable and tense, to rageful, they can be anxious and fearful, have a sort of more physical-based agitation, or a reduced reactivity generally called apathy. So people will say, I just feel blah, and their family or friends will say she just doesn't seem to be quite present, she's just kind of sitting there, and a common expression is to say she's going through the motions. There can be mixtures of these emotions, and sometimes the diagnosis will be listed as adjustment disorder with mixed emotions, adjustment disorder with depressed mood. There'll be sort of a qualifier sometimes on the diagnosis. One of the key things when you're working with mothers is to realize that adjustment disorder spectrum problems often affect the woman's relationships. And that doesn't mean just with her primary partner. It can be with her neighbors and usual social supports, with her own children, and with other family members. And we can see changes both in emotion states, in the way the woman thinks. So someone who's usually more optimistic and can problem solve will become much more pessimistic, only see the downside of things or the worrisome side of things, and behaviors then can change. So for instance, a woman who's usually outgoing and talkative will become more withdrawn and not have sort of the interest or the motivation kind of to leave her home and interact with others. As you can imagine, this will worsen her coping and her own adaptation to whatever she's adjusting to. Addiction relapse for women who are vulnerable to this can be a big risk at this time, because it's a coping strategy that sometimes has a big cost for the woman. Responses are often understandable, but the emotions are excessive, they're out of proportion to the stressor, or apparently out of proportion to the stressor. And what's really important to help women realize is that it's not helpful. So they'll often say, but you don't understand, I feel this way because the following things have happened. And it's really important to have the woman focus on how the response is working for her. Is it helping her? Is it reducing distress? Is it helping her problem solve or get through the issues at hand more? A couple of key concepts we want you to sort of remember. We pay attention to adjustment disorders, even though they're on the more minor end of mental illness descriptions, because they can set a woman up for a more chronic mood disorder if they go unresolved, and or a pattern of these unhelpful coping responses. And while the time frame to onset of the illness and usually recovery from the illness is shorter, the effect on a woman's life and on her mothering can still be very high. And as we know, they're critical periods of attachment and development for young children, which is why, women functioning at their best in the mothering role is so important to the overall mental health of the family. So what would be some typical stressors or triggers that would be related to adjustment disorder for any person, but particularly for mothers? Well, sleep deprivation comes with the territory with mothering often. So that's a very basic physical, biological trigger that even when it's necessary to get up with children or for sleep to be interrupted, it's really not just a luxury for mothers to sleep or nap or rest. It's really critical to their overall mental and emotional and behavioral function. If there's an increased workload, like with a new baby or parenting several children, financial strain, which many young families, are experiencing at this stage of life, moving house, rapidly changing roles. So sometimes women are leaving the workforce, they're changing a job, they have a different role with their extended family than they had before. All these things can be potentially triggers, and one or the other can sort of add up together. Conflicts in important relationships can also be a really fundamental trigger to adjustment disorder. And so in mental health assessment around this, we often ask a lot about the other people in the person's life and kind of what's been happening there. There have been any issues that might seem minor, but may actually be triggering, a response in the woman. Again, this is not always just with her primary partner in life. It's important to inquire about her relationship with friends, with siblings, with her own mother, and with other people sort of in her life. Might even be her boss, for instance. The illness for the woman or other family members is a very common trigger, and really it's related to increased social and practical demand on that mother. So the new baby might be doing fine, for instance, but now there's a concern about asthma, or some other health problem for an older child, which requires mom to really be back and forth to appointments, attentive to schedules around medications, that kind of thing. Various kinds of losses, from pregnancy-related losses to other deaths, to other kind of important people moving away, all those things can add up again to be significant triggers. Often, medically, there will be a period of high sort of intensity during delivery or in the early days after birth of a child, but really medically everything resolves. However, for the mother and for her partner and other family members, it may still be a very traumatic experience that the medical team doesn't always appreciate. And this in itself can set up a state, for instance, of not feeling as safe as usual, becoming sort of more restricted, and a new sense of vulnerability for that mother. So sometimes that's an important area of inquiry as well. Kind of how to, obviously baby might be in front of you doing well, but you may want to know, how did the woman experience pregnancy and the birth of that child? And any kind of trauma in the here and now really can be an important trigger to adjustment disorder problems. So it might be being involved in a car accident, it might be witnessing violence outside of their own family. Again, the nature of the trauma can be very varied. But again, it's important to inquire about, how did this impact this particular woman? How does she feel about it? What was her response to it? So think for a second, do you have a mother sort of in your own experience who has some of these kinds of triggers? Just think for a minute about, women you've worked with, women you've known, and how this might play out and perhaps affect adjustment. Well, here's one example. What about a 26-year-old mother with a 4-month-old infant who has some reflux and colic, getting treated, but really the baby's been very fussy and sleep schedule has been very erratic related to that. and also parenting a 3-year-old toddler. She's just moved to a rural town where her partner can find more promising work. So this is a good move in the long run for this young family. They hope that it'll sort of stabilize. But in the meantime, in the short term, she's had to leave her job as a waitress in the small city where she grew up. And, you know, this little restaurant was sort of popular in this city. Many people came in. She'd worked there for several years. It was really a built-in social network there that, you know, she didn't even herself think about. She has no maternity benefits because of the nature of the work and a lot of her income coming from tips, and has the loss of all of her social and practical supports when she moves to a new community. Unfortunately, her mother is also diagnosed with cancer, possibly treatable, but still a source of anxiety for the family just after this young couple moves. And she can't come to visit our mother as much as planned. Her sister is angry that she's moved away when the mother is ill and feels she's left with all the responsibility. The partner's new job involves long hours, which may pay off eventually in opportunities for promotion and increased income, but they only can afford one car at the moment. She used to go to a gym in her small city where there was childcare, but she's afraid now to walk on the busy highway near her rural home because of the traffic, and the home itself is a bit of a fixer-upper. Again, they're making an investment in their long-term stability, but there's a lot of adjustments, as you can hear, and a lot of potential stressors. So what can happen to her? Well, at the very simple level, she becomes overwhelmed with all of this change. 1 or 2 changes most of us can accommodate to, but when they're rapid, they're extensive, and they follow on one another, all of our coping skills are challenged. She can't use her previous coping strategies around exercise and visiting with old friends. Getting out to the few activities in this new town seemed like too much work with 2 small children. She was a very independent and organized woman in the past, and she says about herself, "I really hate to ask for help." She finds herself just staring in the household at times, not really watching, not really doing anything, unable to make a plan, feels down, mildly so, like not severely depressed. She's begun watching TV more than she likes, but she says she's not really concentrating on the program, and it seems like playing with her toddler, which she previously enjoyed, and she feels very connected to this young child. You know, she's aware that she has this sense that it's a chore, that she finds herself sighing when she thinks about, oh, he's going to want to, you know, play outside, he's going to want to do a new activity. She says she's tearful at times, but not all the time, for no reason, and she's daydreaming about old times at home, positive things, or she's worrying about her mother. Symptoms would be low energy and initiative, mixed anxious and depressed mood, tension with her partner, and social isolation. Again, her response is not helping her cope better. What about treatments? Well, you know, saying to people, oh, you'll get over this eventually is fundamentally not helpful, even though it may be true that in time most people adjust. But there's a lot of distress that may be unnecessary. First of all, support and education of what may be happening for her is important. You know, positioning that this is a mental health problem and a challenge, but it's not necessarily a severe illness. She may not be on the edge of a more profound depression, but really she does need to take some action, and perhaps so do those around her. She needs to really enhance her self-care, possibly consider new activities, because the previous coping strategies, you know, she really can't employ. There isn't the gym with childcare that she can get to on foot. She needs to think about something new. So it might be that, you know, she tunes into an exercise program, watches a DVD, goes on an online chat forum, that kind of thing, to sort of help her sort of have a similar kind of break away from the daily routine, and also get some physical exercise in, but in a different way than she was used to before. Talk therapies can be very helpful, various sorts, to help the woman really see what's happened in her coping style and her thinking, how to adjust that, and how to work sort of in a more positive and effective way for herself to get through this transition in her life. Relationship skill building in a positive way can be really important at this time, so encouraging positive couple interactions and communications can be very supportive of the individual woman. It's not usually the time to tackle more significant relationship problems because you already have a high load of stressors and triggers. It's often important to bring people back to what they do well together, ways in which they've supported one another in the past, and what again the possibilities might be in this new situation. Essentially, you have to meet all these changes with changed behaviors and strategies. Sometimes medications, though, are still used in adjustment disorder, like antidepressants or sleep medications for a short time to support sleep maintenance, lower anxiety, and prevent a more serious depression. But usually, the use of these medications is over a shorter period of time than, say, with recurrent major depression. What about outcome? Well, most people typically have a full recovery. And they can actually build new skills and resilience from the resolution of this particular mental health problem. It's really critical, though, to try and learn for the next time and recognize their own style as a person, their style of thinking. Sometimes we say that, the characteristics a person has or the way they cope will be really strong and work really well for them in certain situations, but actually be sort of not fit and kind of produce negative results in a new situation. So understanding that, we all need to be flexible and thoughtful about how we respond to the challenges in our life can be just a helpful model for a young mother to have. You have to remember this can happen to anyone. Often mothers are really overwhelmed with a sense of failure. Why can't I do this? Other people move. Other people have 2 children. I know a woman who has 5. She seems to be coping fine. What's wrong with me? Again, not helpful. Really remember that for a variety of reasons, all of us can be sort of, knocked off our usual state of equilibrium. And sometimes it's usually understanding that there's a combination of circumstances or something that's particularly meaningful to that person. And as I said, sometimes if there's earlier stress that, a problem, trauma, that may have been resolved truly, there's a reawakening of that with something that's like an echo of the previous trauma. Stressors can be high and many, sometimes it's important to prioritize them and say, the most important things for me to adjust to or tackle are, how do I not socially isolate, and how do I, stay active and meet new people and connect my children up to this community. Maybe the state of the household and all the renovations that need to happen are not the priority at this particular point in time, for example. So key learning points from this discussion are the triggers must be present for this diagnosis. Even if the woman can't figure them out initially, in discussion and assessment, usually that's part actually of the recovery, is understanding kind of the pattern of what happened. It doesn't come out of the blue. It's usually not a chronic or long-lasting mood or mental disorder. Outcome is good, but intervention is important to limit the effects on the mother and her family. It's a very common disorder. Really close to 25% of people will have had a mild to more severe adjustment problem at some point in their lifetime. Very treatable problem, though, and can happen to any of us. Thanks for your attention. Hopefully you'll check out some of our other video learning modules.